when a cluster of children born with abnormally small head circumferences was detected in northeast Brazil in late 2015, identifying the cause of this rapid and unprecedented surge in microcephaly cases was the immediate need that the medical and scientific community was called to meet. Under the leadership of Brazilian infectious disease experts, a task force, the Microcephaly Epidemic Research Group, was formed, bringing together expertise in epidemiology, virology, immunology, and social medicine, and cultivating partnerships with other eminent clinic epidemiological investigators across Brazil and worldwide. The group laid the groundwork for what was to become the Zika Preparedness Latin American Network, Zika Plan, a multinational project that would not only facilitate research to investigate Zika virus, but also create a long-term platform through which the global scientific community would be available to respond rapidly to any future emerging threats in Latin America. Hosted by Sweden's Umeå University and led by scientific coordinator Professor Annelies Wilder-Smith alongside project coordinator Dr. Raman Preet. They were expertly placed to respond to a call from the European Commission as it released funds to investigate the outbreak after the World Health Organization declared Zika a public health emergency of international concern in 2016. Zika Plan harmonized study protocols and initiated a series of groundbreaking epidemiological studies that advanced scientific thought. By connecting the microcephaly cases to Zika virus infections in pregnancy and ruling out alternative hypotheses, such as larvicide. This also led to the first clinical description of a new disease, congenital Zika syndrome. What had previously been thought of as a benign mosquito-borne virus was soon recognized as a global threat, capable of causing severe teratogenic effects.
With the epidemic of microcephaly, we learned that Zika virus can cross the placenta and profoundly affect fetal development, resulting in structural anomalies and functional impairments that may require lifelong care. The partnership and support of Zika Plan facilitated to build and follow the MERG pregnancy and pediatric cohorts to describe the risk, the spectrum, and the evolution of the congenital Zika syndrome. Our investigations have contributed to understanding this syndrome as a spectrum of clinical features that may include vision, swallowing, communication, and neurodevelopment impairments and microcephaly.
From the outset, investigators focused on building connections, including with the families of children with congenital Zika syndrome, creating relationships and systems through which those working in the field and those investigating in the lab could share data would be vital to ensuring a timely and sustainable response. Over the last 5 years, Zika Plan has yielded some of the most robust estimates to date of the absolute risks associated with congenital Zika virus infections, and also provided unique insights regarding the prognosis and health needs of children born with congenital Zika syndrome. With close monitoring of the health and development of more than 700 children, the MERGE pediatric cohort represents the largest single cohort study of children with congenital Zika syndrome and is a uniquely valuable resource for understanding this new disease. In parallel, the research of the Zika-IF cohort has provided unique insights into the vertical transmission of Zika virus and the implications of congenital infection for neurodevelopment. Across the whole of Brazil, the Microcephaly Epidemic Research Group facilitated a nationwide consortium of Zika pregnancy and pediatric cohort studies, known as the Zika Brazilian Cohorts Consortium, which has supported rapid data sharing to inform Brazilian Ministry of Health policy. Internationally, the Microcephaly Epidemic Research Group has worked closely with a range of international investigators as part of a large-scale international consortia, including not only Zika Plan, but also the European Commission-funded Zika Cohorts Vertical Transmission Study Group and the World Health Organization-led Zika Virus Individual Participant Data Consortium. Engaging with policymakers, public health officials, and affected families was prioritized throughout, so that their scientific findings would be expediently translated into evidence-based policy. The group's work informed the Zika-related guidance of the Pan American Health Organization and the Brazilian Ministry of Health, and in fact, it was largely thanks to the advocacy of the Microcephaly Epidemic Research Group that the World Health Organization and the National Health Emergency in Brazil recognized the cluster of microcephaly and other neurologic disorders as a public health emergency of international concern. The scale and dedication of the group's efforts set an important new precedent for how the global scientific community should respond to emerging infectious threats, including today's COVID-19 pandemic.
While the Zika virus pandemic has ended, the devastating health and social impact on children with congenital Zika syndrome and their families continue. In looking forward, our top priority as a research team is on understanding how congenital Zika virus infections may influence children's neurodevelopment and behavior as they reach school age and beyond. We hope to continue to work together through our meaningful international partnerships to understand the needs of affected children so that we can better advocate for effective support services for children with congenital Zika syndrome and their families.